When it comes to the management of MS, the first step is accurate diagnosis. And then the management you can think of as two major components. One is choosing the right disease modification therapy based on patient's profile and their risk tolerance. And then the second component is what is called symptom therapy or symptomatic management. That oftentimes involve additional ancillary services and additional specialty services. For example, some of our patients can have severe pain from MS or spasticity. So there are medications a neurologist can prescribe to make these symptoms better. Sometimes you may need administration of botulinum toxin. That can be done by somebody trained in administration of the toxin. And then oftentimes bladder issues are very common in people with MS. Simple bladder symptoms can be managed by a neurologist, but sometimes you may need a specialized care from a urologist that has experience with taking care of patients with MS. It's a complex disease, and the management is also complex. Oftentimes you cannot address all the issues with one particular patient in one single visit. So sometimes you may need more than one visit. Therefore, a close follow-up is needed. How often you see your MS neurologist depends mostly on the spectrum of MS you have and the kind of treatment you have. Oftentimes, if it is a very mild form of MS, or maybe even sometimes patients can be seen only once a year. But majority of our patients who are on disease modification therapy usually see the MS neurologist once every 3 to 6 months. MS symptoms can fluctuate, but a new attack of MS is something that is present consistently, at least for a day, and in the absence of any fever or infection. In fact, that's the definition used in the clinical trials. Or if the old symptoms are getting worse in the absence of fever or infection, and they are getting worse, lasting longer than a day, that is something should be worried about, and they should reach out to their neurologist to confirm whether this is an MS attack or not. When there is a concern for a new MS attack, typically your neurologist will get a detailed history and detailed neurological exam, and if needed, may confirm the attack with an MRI scan. And once the attack is confirmed, either based on just clinical findings or with an MRI, they usually prescribe you medications to hasten the recovery from this attack. Typically, this is high-dose Solumedrol administered intravenously. In certain situations, you can also give high-dose steroids orally. In addition, rehabilitation is a major component of MS therapy, more so in treating the acute relapses and also in the progressive phase of MS. So rehabilitation, including physical therapy, occupational therapy, and even cognitive rehabilitation plays a major role in optimizing the care.